Okay, hello everyone. If you're watching this, that means something went wrong with my computer or the internet, but nonetheless, backup plan, let's get started. Today we're going to look at feet problems in older adults. Okay, so to get started, feet problems in older adults are pretty much conditions that affect the structure, circulation, the nerves, skin of the feet, and these issues sort of interfere with normal function and comfort, obviously. And there are four main categories. We have musculoskeletal problems such as bunions, hammer toes, flat feet, of course involving the bones and the joints. You also have dermatological conditions like calluses, fungal infections, and ulcers, which are the skin and the nails, affecting those. And third are neurological issues, such as peripheral neuropathy, which can impact nerve function and sensation. And lastly is also vascular problems. So this is like poor circulation, ischemic changes, and this reduces the blood flow to the feet. And it's important to recognize these categories because your treatment and plan for them will be different and prevention. So, foot health is extremely important for older adults because their feet are essential for their mobility and for their independence. And if they have like a foot pain or deformity, their walking and physical activity becomes significantly limited. And poor foot health can lead to serious consequences like falls that we saw last week, fractures, or even social isolation. And that's why regular care and early treatment are key to maintaining autonomy and obviously a good quality of life. Foot problems are very common in older adults. Around 70 to 80% of people over the age of 65 have at least one chronic foot problem. And women tend to be more affected than men. And there's conditions like diabetes and vascular disease significantly increase the risk of foot complications. And there's about 25% of older adults experiencing disabling foot pain that impacts their daily life. Okay, so as we age, feet undergo several changes that affect comfort, affects mobility, and first of all, there's less cushioning in the feet. So that reduces shock absorption. And we also lose muscle tone, we lose flexibility, which makes our movement less stable. And the joint stiffness often develops due to osteoarthritis. We can have nails growing really slow, nails that become thicker, they're harder to manage. Circulation and sensation decreases, which can increases the risk of injuries, infections, and well, the skin becomes thinner, right? So it becomes less flexible. The fatty padding is pretty much gone, and these changes can alter our walking patterns. So we have a shortened stride length and reduced joint flexibility. So let's talk about some of the risk factors. First things first, chronic illnesses like diabetes, peripheral arterial diseases, arthritis, these play a major role. You can also consider poorly fitting shoes to be a risk factor. So like high heels, narrow toe boxes, or shoes with worn down soles. This can cause pressure points, leading to injury. You can also consider obesity or immobility because these increases different pressure points. That leads to pain and deformities. There's also neuropathy, but this reduces protective sensation, so your injuries go unnoticed. And there's also poor hygiene or an inability to perform self-care. You can get infections, different complications from this. And recognizing these risk factors is essential for prevention and early intervention. Common symptoms of foot problems in older adults are like pain, burning, tenderness in the feet. Numbness or tingling is another frequent complaint, often linked to nerve issues. They might have thickened or discolored nails that can indicate fungal infections or other nail disorders. There can be foot deformities like bunions, claw toes, or flat arches. These are also pretty common. Skin changes you may even be able to see, like dryness, cracks, redness, or even ulcers. And what else? Older adults experience difficulty standing or walking, which can also obviously affect their independence. Now, here on the image that I have, you can see that this person has, we can even suspect flat foot. We see this as claw feet and maybe a little bit of fungus on the nails as well. So older adults often experience several common foot conditions. First up is bunions, or also called hallux valgus. It's pretty much the bony bumps that form at the base of the big toe. There's also hammer toes that occur when the toe joints bend abnormally and it causes discomfort, deformity. There's also calluses and corns that develop as thickened skin from pressure or friction. There's onychomycosis, which is the fungal infection that affects the nails, making them super thick, super discolored. There's also diabetic foot ulcers, which are pretty much open wounds caused by neuropathy and poor blood flow. Peripheral neuropathy is also another condition that involves nerve damage that leads to numbness or burning sensations. You have peripheral artery diseases that reduces blood flow to the feet and increases the risk of complications. And even in the image here, you can see a little bit of a bunion here, maybe a little bit of the thickening of the nails. Okay, so now let's talk a little bit more about the musculoskeletal problems. Now, with bunions, these occur when the big toe joint becomes misaligned and it creates a bony bump, and this can lead to swelling and pain. Hammer toes can come from an imbalance in toe muscles, which makes the joints bend abnormally, and this leads to pain as well, and often calluses. Flat feet develop when the arch support is lost. This can cause fatigue and a lot of discomfort when you're walking. And arthritis, as we all know, affects the joints, leading to inflammation, stiffness, and sometimes deformity. And these are conditions that often progress over time and require proper footwear, exercise, and sometimes medical intervention. Now, from a dermatologic point of view, these are issues in older adults that often affect the skin and the nails of the feet. Now, calluses and corns form as thickened skin due to friction or pressure, often due to ill-fitting shoes. Onychomycosis, the fungal infection, that is also considered here under dermatologic problems. Third is dry or cracked skin. This can lead to painful fissures and increase the risk of infection. And finally, ulcers, which are open wounds that may progress to deep infection if not treated promptly. And that's what I have here in the image, the pretty deep ulcer that we're looking at. Now, in terms of neuropathic problems, peripheral neuropathy is one of the most common neuropathic problems in older adults, and it's often linked to diabetes. It leads to the loss of sensation in the feet, which means injuries, burns, ulcers. Sometimes they don't feel it, so it goes unnoticed. And the typical symptoms include numbness, tingling, and a pins and needles feeling or burning pain. And the symptoms often worsen at night and can impair balance and coordination, which increases the risk of falls. Managing neuropathy is absolutely essential to prevent complications and maintain mobility. Here I have an image from the CDC, which pretty much just highlights warning signs of diabetic foot problems and when to see a doctor. So it shows several symptoms that you need to watch out for: tingling, burning, pain in your feet, changes in color, temperature, dry or cracked skin, loss of feeling or inability to sense heat or cold, thick yellow toenails, loss of hair on feet, toes or lower legs, fungal infections, ingrown toenails, and much more. So if you have any of these signs or they begin to appear, your patients have them, it's important and crucial that they visit a doctor. Now, with vascular problems in older adults, it often involves peripheral arterial diseases, and this occurs when arteries become narrowed, reducing blood flow to the legs and feet. And common signs here are shiny skin, hair loss on the legs, weak pulses, and delayed wound healing. It can cause pain when walking, known as claudication, and in several cases, pain even when they're resting. If you leave it untreated, it can lead to serious complications such as gangrene, which may require amputation. Early detection and management are absolutely critical here to prevent that extreme outcome. Now, diabetic foot complications. Now, this one occurs due to a combination of neuropathy, poor circulation, and increased infection risk. And these factors can often lead to ulcers, tissue deaths, and obviously in severe cases, and the picture that I have here, amputation. So managing these complications requires a multidisciplinary approach involving all different types of doctors, physicians, nurses, podiatrists. Prevention here is key because you need to do daily foot inspection, you need to use proper footwear, maintain good glucose control, and significantly reduce the risk of having these horrible issues here. So, well, my presentation isn't diabetic foot, but I want to mention this. The images I have here shows the severity and rapid progression of diabetic foot complication. You can see in the first image how quickly it progresses. It starts on Monday with an intact foot, break in the skin by Tuesday, leads to infection by Wednesday, gangrene by Thursday, and it requires amputation by Friday. So it's really important to be able to detect this and act rapidly. Okay, so now let's talk about evaluation. We begin with visual inspection. We look for changes in color, swelling, wounds, or nail abnormalities. Then you can move on to palpation. You assess temperature, tenderness, and check for pedal pulses. After that, perform neurologic tests such as the monofilament test and vibration sense evaluation. Then you can do vascular tests, Doppler studies, or imaging studies like X-rays or even MRI. Okay, now let's go over key strategies for foot care and pressure relief. So first things first, you treat the underlying cause, such as diabetes, arthritis, infection, whatever it is. Then you need to relieve pressure points by using padding, specialized footwear. For example, this one here is a specific shock absorbing sole, high rebound midsole, and stable heel ring, and this pretty much protects the points, reduces pain, and keeps the feet healthy. Third, they also need to maintain it, right? They need to keep it clean, dry, and moisturized to prevent cracks and any infections. The toenails need to be trimmed to avoid ingrowns. And of course, if there's diabetes involved, you have to control the blood sugar or address any sort of circulation problems. All of these are critical for healing and prevention. Okay, so now a quick little review of surgical management and medical. So first, topical medications like antifungal or antibiotic cream are used to treat infections. You can also do pain management like NSAIDs or local creams to reduce the discomfort. Wound care is big here. Now you need to do sterile dressings and debridement to promote healing and prevent infection. And surgery may also be necessary if you need to correct any sort of deformities or removing infected tissue. And then finally, physical therapy to help improve gait, strength, and just support overall mobility. So this was a case study I found that I thought was pretty interesting. Here we have a male patient with an 8-year-old history of diabetes who developed diabetic foot ulcer. He was getting treatment, but it was still getting bad. They ended up doing a combination therapy, which was surgical debridement, maggot therapy, and negative pressure wound therapy. So I want to show you guys the process that this guy went through and the results that came of it. So he started off, well, this was before he started the combination therapy. So this was the ulcer that he started off with. He then proceeded to get surgical debridement, and this is how it looked after that first step. Now let's move on to the next step. So after he did that, he went on to get maggot therapy, and here are the maggots on his feet. Now let's move on to the next step. The next step was negative pressure wound therapy, and it pretty much just did his foot. And okay, now let's look at the healing process. So after all the steps that he went through, you can see it actually healed up pretty nicely. So it was just showing that combination therapy has a really good approach to diabetic foot ulcers and treatment. But now, like in terms of prevention, so you don't have to go through all that. The first things first, inspect your feet daily for cuts, swelling, any color changes. You should also use soft, comfortable, and well-fitted shoes to reduce pressure and prevent injuries. You should also keep your feet dry, change your socks daily to avoid fungal infections. Try to avoid walking barefoot because this increases the risk of injury and infection. And fifth, if there's chronic illnesses present, manage the diabetes and manage the circulation problems through proper medical care. And maybe visit podiatrists. It depends. Some of these can be done by yourself, some of them might need medical intervention. Alright, now a quick little summary. Foot problems are extremely common in older adults, and if you ignore it, it leads to pain, disability, and even on the extreme side, amputation. The good news is early recognition, proper care, and preventive habits can preserve mobility and, more importantly, independence. So, healthy feet just means a more healthier and more active life.